Now, who is this guy? He is none other than Justin Bieber, isn't it? He recently told how he was infected with condition that caused facial palsy along with vesicles in the ear canal. And what is that condition? It is nothing but Ramsay-Hunt syndrome. Okay, as you can see in this picture, Ramsay is hunting down. And yes, this Ramsay-Hunt syndrome is characterized by a otitis externa along with the vesicles all over the pinna and external canal, and along with that he will be having a facial palsy as you see here. And it is a condition which is caused by the herpes zoster virus, and that's why the vesicles are happening, and this herpes zoster infects the geniculate ganglion. Okay, geniculate ganglion, and it is from the geniculate ganglion the facial nerve arises, and the distribution of facial nerve through the nervous intermediates is getting affected. That is why the vesicles are seen in external canal and pinna in the area where it supplies. Okay, and apart from this, there will be facial palsy. And how the patient is treated? Patient is treated with steroids plus antiviral drugs. Okay, you will be learning the details in the chapter on the facial nerve. And for now, let's move on to the next viral otitis externa, and it is also known as bullous meningitis. It is nothing but otitis externa hemorrhagica. Otitis externa hemorrhagica or bullous meningitis. Okay, bullous meningitis. It is characterized by multiple bullae in the deep meatus and tympanic membrane. Okay, so this condition will require ear packing with a steroid. Okay, and isotretinoin will be needed. Along with that, antivirals also can be given. And what is the cause of the condition? That is what is usually asked for the exam. It is caused by influenza virus as well as Mycoplasma pneumoniae. Even though it is not a virus, Mycoplasma pneumoniae also can cause otitis externa hemorrhagica. Okay, especially in patients with atypical pneumonia caused by Mycoplasma pneumonia, this bullous meningitis can also occur. Okay, so that's about viral otitis externa. A 70-year-old diabetic male patient presents with external ear infection involving bony canal. Drug to be started with is penicillin, second generation cephalosporin, erythromycin and ciprofloxacin. From the question itself, it is very clear the condition is nothing but malignant otitis externa. Okay, and this malignant otitis externa will require anti-pseudomonal treatment. Okay, and anti-pseudomonal treatment can't be accomplished with second generation cephalosporin. It requires third generation cephalosporin in the form of ceftazidime. Even ceftriaxone is also not effective. It should be specifically ceftazidime, and hence it is ciprofloxacin that is being given for malignant otitis externa or skull-based osteomyelitis. Okay, ciprofloxacin, it is being given in the dose of 750 mg BD. Okay, 750 mg BD. Usually it is 500 mg BD, but in case of MOE, you are giving 750 mg BD for better penetration into the skull base, and it has to reach the bone marrow, right? So that is why we are giving at a dose of 750 mg BD. Now coming to the next question, fungus causing otomycosis is most commonly. In this question, you might be tempted to write Aspergillus fumigatus, right? But no, it is not Aspergillus fumigatus. It is Candida, because after Aspergillus niger, it is the Candida which is the second most common, and only the third most common is Aspergillus fumigatus and Aspergillus flavus. Okay, so the answer to this question is Candida. Okay, so that's about the various types of otitis externa. We have learned about the otitis externa in general, which means bacterial otitis externa, and it involves localized otitis externa, malignant otitis externa and diffuse. And we have learned about the otitis externa caused by the fungus known as otomycosis, and viral otitis externa, which includes the herpes zoster oticus or Ramsay-Hunt syndrome and bullous meningitis or the otitis externa hemorrhagica. Okay, now coming to foreign bodies in the ear canal. If it is a live foreign body like this in the ear canal, what will you do? First of all, you will have to make that live foreign body dead. Okay, for that you can actually put oil, because these cockroaches, what they have for the respiration are actually seen outside, isn't it? Its respiratory organ is seen outside and it can get clogged if you are putting oil in the ear canal. Okay, so that is one thing that can make it dead. Or you can simply put local anesthesia, you can put topical spray, lidocaine spray. Anyway, the most commonly available home remedy is oil, but you should not use any hot oil or anything. We are just putting some oil so that the thing dies. Okay, if the cockroach dies, there won't be any further trauma because of the movement of the cockroach, isn't it? So we have to prevent that. For doing that, we are putting the oil, and once it is dead, you can safely remove it easily. Okay, so how is it being removed? You can see how carefully you can remove it using a forceps like this. Okay, or you might even use a syringe like this. This is how you use a forceps for removal, or you can use a syringe. Okay, you can syringe the ear for removal of the foreign body. How do you do a syringing? Okay, you can use a 20cc syringe like this. A plastic syringe may be used, or you can use a Simpson syringe, a particular type of syringe which is available in medical colleges for exam purpose. But usually this is the syringe that is used. That is a normal 20cc syringe is being used with a cannula, and a jet of air is directed in the posterior-superior direction. Posterior-superior direction. The jet of water is directed like this, and the water comes like this and then removes the foreign body along with it. That's how you syringe the ear canal. But the syringing of ear canal is contraindicated in certain conditions like this. What is this? What do you see here? This is a button battery, right? Button battery is a definite contraindication for syringing. Okay, syringing is contraindicated when there is a button battery. Okay, and what are the other contraindications for syringing? One is chronic otitis media, that is when there is a perforation of the tympanic membrane. It is being contraindicated. And then I already told you button battery, because the contents of the battery can seep out, and that can cause inflammation, severe inflammation, and it can even cause facial paralysis. Okay, and what else can be used apart from the button battery? What else can be the contraindication apart from the button battery? Yes, tell me. This is some contraindication that always you have to remember. What is that? It is a vegetable hygroscopic foreign body. Okay, hygroscopic foreign body. There is another contraindication, because if it is hygroscopic, what happens? The water enters and it can swell up. Okay, so these are the contraindications for syringing. Now, what else do you use a syringing? Syringing is the most commonly employed technique for removal of earwax. Okay, earwax can be easily removed by syringing. Okay, by syringing you can simply remove the earwax like this, or you can use a wax hook like this. Okay, wax hook. Wax hook, if you see carefully, you can see that it is having a ring here, and here it is having a blunt end. Okay, and since it is known as Jobson horn probe with ring curette. Okay, wax hook is also known as Jobson horn probe with ring curette. Okay, the Jobson horn probe, the probe end can be used for removal of the earwax. Okay, so it has got a ring here. Sorry, the probe, and you can, this is the probe blunt end, and this is the rounded, and this ring end of the thing can be used for removal of the earwax. Okay, you can simply drag the earwax out if it is becoming solid, and if it is easily removable, you can simply drag it out like that. Okay, and the other end you can use for putting cotton like this, and for application of ointment we can use this Jobson-Horn probe. Okay, so that's about Jobson-Horn probe. It has got two ends. One is the ring curette end and the other is the blunt probe end, and it is in this blunt probe end where we put the cotton, and in the ring curette end it is being used for removal of the earwax. Okay, now if the earwax is not getting removed in spite of the efforts after putting wax solvents, what are the wax solvents that are being used for softening the wax? You can use sodium bicarbonate. Okay, sodium bicarbonate. Okay, that is the most common wax solvent that is used. Okay, then terbutaline. There are a lot of things that are being used for so dissolving the wax. It is not usually asked for the exam, but usually it is being put for about 1 week, 2 drops 3 times a day. Okay, the sodium bicarbonate ear drops are put for 1 week, and after dissolving the wax it is easily removed by syringing. Okay, but if it is not getting removed in spite of twice trying with wax solvents, then you have to suspect a condition known as wax keratosis. Okay, what is this wax keratosis? Wax keratosis is being caused by abnormal epithelial migration. Abnormal epithelial migration. When a sudden lockdown was imposed with the advent of COVID-19 in India, what happened? A lot of migrant workers got stuck like this, right? Similarly, when the normal migratory pattern of the external canal is being affected due to some cause, what happens is that the desquamated epithelium gets trapped in the external canal. Okay, desquamated epithelium gets trapped in the external canal, and the external canal gets ballooned and swollen up like this. Okay, here you have the desquamated epithelium, and it is actually forming an onion peel type of appearance. Okay, these keratin debris, it shows a onion peel type of appearance. Okay, and when you examine the external canal, it will be very wide and roomy. Okay, it will show a wide and roomy external canal, especially after removing the keratosis debris. Okay, keratosis obturans, it is very difficult to remove, and it has to be removed carefully under a microscope after proper wax solvent usage, and it has to be done in a theater setting. Okay, and yes, after meticulous removal of the keratosis debris, sometimes you may even need to do a canalplasty for a patient with this keratosis obturans. Okay, now what is the most common differential diagnosis of keratosis obturans? It is nothing but external canal cholesteatoma. Okay, when there is a defect in the external canal like this due to a trauma or some inflammation, what happens is that the desquamated epithelium gets collected here. Okay, and it gets sequestered. It gets sequestered there, and because of that localized defect, the desquamated epithelium gets collected here, and it becomes foul smelling, and it has got bone invasion properties, and hence it is known as external canal cholesteatoma. There is another cholesteatoma which you will be learning later on, but this is something else. Okay, it will cause a painful ear, and along with the pain there will be ear discharge, and it will be foul smelling ear discharge. Okay, why? Because of the bone erosion. Bone erosion is occurring, and that can result in foul smelling ear discharge. Okay, and that is what is known as external canal cholesteatoma. Okay, and what is the closest differential diagnosis of this external canal cholesteatoma? It can of course resemble a malignancy of external aortic canal, or it could be a malignant otitis externa. All these things have to be differentiated before jumping into conclusion that it is an external canal cholesteatoma. And what did I tell about malignant otitis externa? You have to take a biopsy from the granulation tissue to rule out malignancy. Okay, now what do you see here? This is nothing but a keloid, isn't it? Keloid is actually a scar which is developing beyond the wound margin. When the scar is developed beyond the wound margin in the form of granulation tissue because of the proliferation, that is what is known as keloid, and it is usually seen in African and Asian individuals. Okay, now if this keloid is seen in the pinna like this, okay, what will you do? You have to excise it, of course. You will have to excise it and suture it. Along with that, you have to give intralesional steroids. Okay, intralesional steroids are also to be given for keloid of pinna. Okay, keloid of pinna. Now coming to the next condition which is commonly seen. What is this? What do you see here? Yes, it is seen in the helix, isn't it? And it is an inflammatory condition. Now what is that known as? That is called Winkler's disease. Okay, it is nothing but Winkler's disease. Now what is this Winkler's disease? Winkler's disease is nothing but chondrodermatitis nodularis helicis. From the word itself you can get what it is, right? It's the inflammation of the helix. Okay, in the helix area there will be localized inflammation in the skin as well as the cartilage, and a nodule will be formed. Okay, and it is seen usually in males in middle age, and it is seen when lying on a particular side, okay, on hard surfaces when it is being used, and when it is causing repeated trauma to the pinna trauma. Okay, that can result in this chondrodermatitis nodularis helicis, and in this condition what you can do is you can use soft pillows instead of the hard pillows can be used for this condition. Okay, and yes, you will have to advise the patient not to lie on the ear. Okay, not lie on to that side and try to lie down straight. Okay, the repeated trauma on one side of the pinna has to be avoided. Okay, so that's about chondrodermatitis nodularis helicis, and it is also known as Winkler's disease. Okay, Winkler's disease. Now coming to another condition of the ear canal, and that is the most common benign tumor of ear canal. What is that? From the picture itself you can get it, right? Most common benign tumor of ear canal. We have already told about the malignant tumor of ear canal, isn't it? It is being caused by squamous cell carcinoma, and when a patient comes with a lesion like this, okay, initially we can treat it like this Winkler's disease, but you also have to suspect something else. What is that? Yes, it is nothing but basal cell carcinoma. Basal cell carcinoma is the most common malignancy of the pinna. Okay, most common malignancy of pinna is basal cell carcinoma. It is being followed by squamous cell carcinoma. Okay, squamous cell carcinoma is the second most common cause of malignancy of pinna, and it has to be ruled out by taking a biopsy. Okay, if you are suspecting that you have to definitely take a biopsy. Okay, that is the most common and second most common cause of malignancy of the pinna. But now I am talking about benign conditions. Okay, what is the most common benign tumor of external aortic canal? It is also known as surface ear, and it is actually a protective mechanism seen in surfers or people who are living near the sea, okay, who are always going for diving and surfing and are having constant exposure to cold water like this. Okay, to prevent the caloric stimulation by the cold water, the body develops a protective mechanism called exostosis of ear canal. Okay, exostosis of ear canal. As you can see here, the exostosis of ear canal are actually near to the tympanic membrane in the bony EAC. Okay, deep to the bony EAC it is seen, and it is seen as multiple and bilateral, and of course it is sessile, and this condition, if it is not causing any problem, you can leave it as such. Okay, it is a very benign condition. And what you see here, this is the second most common benign tumor, and that is nothing but osteoma. And this osteoma is seen a little more laterally, and is usually pedungulated. Okay, osteoma seen laterally, and it is usually unilateral and pedungulated. Now, what is the treatment of these conditions? You will have to excite it. And how will you do it? You will have to use a near drill to remove it. Okay, ear drill is being used to remove it. Okay, an ear drill can be used for removing of the osteoma or exostosis. Okay, so these are the neoplastic conditions of external ear. We have already learned about the squamous cell carcinoma of external ear, and I already told you that the treatment is excision of the and sometimes sleeve resection will be needed for that, for the squamous cell carcinoma. You need not go into details. It is not usually asked for exam, but for completion's sake I am telling, squamous cell carcinoma of ear canal is the most common neoplasm of external ear, the malignant neoplasm of external ear. And yes, in that condition, if it is in the later stage detected, then you will have to go for surgery followed by radiotherapy. Okay, so that's about the various inflammatory and neoplastic conditions of external ear. Today we have learned about the various inflammatory conditions of external ear, and we have learned that external ear inflammation is also known as otitis externa. Okay, and from the name itself we are getting it right. Otitis means inflammation of the ear. Externa means when it is restricted to the ear canal. And we have learned about the various types of otitis externa, that is bacterial, viral and fungal. And this is further divided into 3, right? That also you learn, and viral also divided into 2. Fungal, we have learned the 2 different etiologies of that, most common etiologies. Okay, and what else did we learn today? We have learned about ear wax and how it is removed with syringing, as well as a wax hook, right? And we have learned about keratosis obturans and EAC cholesteatoma. Then we learned about the tumors of external aortic canal and pinna. Pinna, it is a most common condition which is causing a benign tumor. Which is that condition? Yes, it is nothing but basal cell carcinoma, and it is followed by a squamous cell carcinoma. Okay, and we have learned about the Wingler's disease. Okay, so these are the various inflammatory and neoplastic conditions of external ear that we have learned today, and we will be going to the anatomy of middle ear in the next class. Today all of you go and learn everything that has been taught today, and try to revise the topics which I already told you. The most important thing regarding preparation, whether it is for your MCQ entrance exams or for theory exams is revision, because whatever you have learned you will have to reproduce during your exams, right? And if you have to remember that, you have to revise whatever little you have learned. Only if you revise, you will be able to write it down for your exams. Okay, so please go and revise the topics which I already taught you and try to do as much MCQs as possible. Thank you.